name is Dr. Pradeep Haranahalli. I am working as a senior consultant interventional cardiology at Manipal Hospital, Whitefield. TAVR means TAVR stands for Transcatheter Aortic Valve Replacement. It is a minimally invasive procedure to replace a narrowed aortic valve which has failed to open up properly. It's not. TAVR is a minimally invasive procedure when compared to the open surgical procedure for replacing the aortic valve. TAVR procedure involves making a small hole in the large artery of your leg called femoral artery, and the procedure is done under sedation. Any person with severely narrowed aortic valve, that is severe aortic stenosis leading to symptoms, is a candidate for TAVR procedure. Any person who is considered high risk or elderly for undergoing a open surgical aortic valve replacement are a candidate for TAVR procedure. The typical tissue aortic valve which is used in open surgical aortic valve replacement are expected to last for 10 to 20 years. Similarly, the TAVR valve is also biologically made up of similar tissue material and are expected to last for a similar duration. Typically, a TAVR procedure takes about 90 minutes, unlike the open surgical aortic valve replacement procedure takes about 4 to 6 hours. Typically, TAVR patients recover faster than they would have otherwise undergone a traditional open surgical procedure. Most TAVR procedures are done under conscious patients with mild sedation but not under general anesthesia. Typically, patients stay in the hospital for about 3 to 5 days before they go home, out of which they stay in an intensive care for about 1 day for initial observation. Like any other medical procedure, there is a significant possibility of serious complications. Some of the most serious complications can include death, complete heart block, congestive heart failure, stroke, bleeding complications, and myocardial rupture. The most common complications are stroke, paravalvular leak, complete heart block, acute kidney injury which is temporary and reversible, and myocardial perforation. TAVR procedure, initially offered only to the sickest of aortic stenosis patients, is now being increasingly used in treating stable patients almost as an alternate to open heart surgery for replacing aortic valves, and most patients recover faster and sooner than if otherwise they had undergone an open surgical procedure for replacing aortic valves. TAVR is now an option to nearly all patients with aortic valve stenosis. Yes, most patients will continue with antiplatelet medications, anticoagulant medications, in addition to other heart failure and cardiac medications after a TAVR procedure. These medications are essential to prevent blood clot formation over the newly implanted valve. Manipal Hospitals, Whitefield has been a center of excellence for routine performance of complex interventional procedures like TAVR. Thank you.